Mr. Speaker, will you please call the House to order?
The bill is passed.
We'd like to get a budget that represents the interests of the people who are standing here with me now.
To be part of the struggle to achieve a better society for all.
And that's why I think that this legislation is an opportunity for us in this House
Hello and welcome to this edition of Assembly Update. I'm State Assemblyman Robin Schimminger. I represent Kenmore, Town of Tonawanda, North Tonawanda, as well as Black Rock and Riverside and North Buffalo. Today I've got guests. These guests are from the Neighborhood Health Center in North Buffalo on Lawn Street. And we're very lucky to have two of them here today. The head of the center, Joanne Haefner, and the chairman of the board of the health center, Keith Lukasik.
Yes.
And I want to clarify, it's Lukasik, not Lukasik, as the family in North Tonawanda. So I'm not mispronouncing his name. The pronunciation here is Lukasik.
Thank you.
So I want to welcome both of you. This is great that you're here.
Thank you.
The Neighborhood Health Center, tell us a little bit about it.
Well, we have 4 locations, but the one that most people are familiar with is our oldest location on Lawn Avenue. Our original name was Northwest Buffalo Community Healthcare Center because we were located in the community center, and we're birthed from them, from some community members who really knew that there was an opportunity for more access to primary care over 30 years ago.
And that access to primary care was a need that was perceived by those people, perhaps because it was difficult or inconvenient or whatever to have one's own individual primary physician. Was that part of it?
Sure. The school closed, Old School 79, and a Head Start and some other services opened, and moms and kids were coming there for school, and they actually couldn't sign up because they didn't have a physical, didn't have immunizations, and the community center really worked hard to find somebody to come in and help, and when no one would, they actually started to look for ways to provide the services and realized that the mission of the federally qualified health centers to be birthed from a neighborhood, to meet the needs of the neighborhood, and to make people proud to be able to have a doctor's office to go to was something that would help people to have better lives, including getting out of poverty.
So these centers are kind of a result of a federal initiative a long time ago. Is that how the genesis occurred?
Absolutely. Jack Geiger, over 50 years ago, sent public health workers at the insistence of President Johnson out into communities and said, find out what people in neighborhoods need to have sustainable lives and get out of poverty. And from that, our movement was birthed.
And now across America, there are
thousands
of these neighborhood health centers. And we're lucky to have one in North Buffalo on Lawn Street. And it's the flagship of your multi-unit system, of which you've got, what, about 4?
We have 4 sites. We have the oldest that we're talking about today. We have one on Commerce Place in Hamburg that just provides women health for over 18 years. Our third office is the old Columbus Hospital at 300 Niagara Street. And then our most recent office is in Blaisdell at Lake Avenue. So really all of our buildings have been repurposed buildings in neighborhoods where care is needed.
Now your role as the chief is you've got responsibility for all of these or just?
I'm responsible for all of the sites. I'm also a family nurse practitioner for the practice, so I still get to see patients on Tuesday mornings. And I'm the employee of the board, and the board employs the CEO to carry out the mission and vision of the organization and then hire the team to get us to the goals that we set.
What a nice transition to ask Keith a question now.
Sure.
How long have you been on the board, and what's your background?
I just finished my first term, which was a 3-year term, and I'm starting up my second term. And I was introduced to the center when I moved to Buffalo back in 2012. I was looking for a healthcare provider, and through mutual contacts was connected to Joanne, became a primary care patient and a dental patient. And then about 6 months later, I had the opportunity to join the board, which was great for me because it was a great way to get involved in the community in Buffalo. Having been new to Buffalo, I travel for work. I'm a consultant, so I'm on the road a fair amount. So it was really a great way to get a way to make an impact in Buffalo. So was on the board for a couple years and then had the opportunity to take over as chair. And during my time as chair, I've been really proud to see the organization grow. The opening of the new site in Blaisdell last year was a massive accomplishment for the organization. We received a new access point grant from HRSA, and we revitalized a grocery store that had been vacant for, 8 years? And we're now able to provide primary care to patients that really, or a community that really didn't have access to care at all in that region. So it's been really great for me, and I'm really proud of the work that Joanne and her team do.
That's an interesting story you told, Keith, about your choice when you moved here from, where was it, Michigan?
Actually from New York City.
From New York City,
Yes.
but you're from originally Michigan.
Yes, I am from Michigan originally.
Upper or lower? Upper
Oh,
Peninsula?
lower near Detroit.
Near Detroit?
In the suburb of Detroit, yes.
Okay,
Yeah.
okay. Let me ask you, do a lot of people, when they move into town, make the choice for their health care services to focus on going to a center, a neighborhood health center, clinic, whatever, or do they try to find an individual primary doc?
I'm not sure I know the answer to that. I think for me it was about access, and I was actually able to get into a neighborhood health center very quickly, where other organizations, such as traditional private practice.
Many of them don't take new patients.
Yes, or have a long wait time. So for me it was part convenience, part just I had met Joanne and immediately became connected to the mission.
That's a wonderful thing. I think, and the advantage of receiving one's care at a center like this is that there is an array of services there at the center.
Yes, yes, and we're continuing to add services. So it's primary care and all the complementary services. We have adult primary care, we have pediatrics, we have behavioral health, nutrition, podiatry. We most recently added endocrinology, which is massively important for our patient populations, many of which have diabetes. So being able to provide access to endocrinology is really amazing that we can do that as a federally qualified health center.
And women's health.
And women's health, sorry.
Yes, of course. Yeah. And now in every, I know you've got a medical director, Dr. Barano, great man. Is he the director for all the centers or for all the centers?
He's our chief medical administrator, and he has
Got
a
it,
partner
got it.
who's a medical director, but between the two of them, they oversee all the providers and clinical services.
Okay, so it's top flight, quality care, accessible, convenient,
Right, right.
and it's a total package.
We also offer a pharmacy that we should, it's really important to mention that because economically it allows us to fund other elements of our mission that may not have the direct financial reimbursement to be sustainable. So that was important, but also, most importantly, being able to make sure that our patients, when they leave, have their prescriptions has been a major driver of quality. So we have an on-site pharmacy at our Matino location and also our Blaisdell locations. Then for the main Lawn Avenue site, we offer a courier service.
You know, there was a great epiphany a number of years ago in the medical community that, oh my gosh, wouldn't it be a great idea if we could have docs, primary care docs, be, the medical home for the patient. This would be their medical home. Well, wait a minute. You all have been doing that forever. That's the concept, right?
Yes.
Of the center, to be the medical home.
Absolutely. I think that the mission and the movement started to assure that people move out of poverty, and that's still really important to us. But we also, to Keith's story, we are anybody's doctor's office, and there's a model of care that, that people can come and get everything in one place, and we know their health outcomes are going to be better if it's convenient for them. So.
Yeah. Now you're here, even though the center's got their origin in Washington, you're here in our state capital of Albany, because I suspect that there are some things you're looking for from the state legislature, some changes, some improvements, some enhancements. You've given me a little package here, so tell us about your advocacy today.
Sure. So this is Health Center Advocacy Day. The things that are important for us are there's a patient-centered medical home initiative that's been going on, and you've been a supporter of that. Some of the legislation that's in place right now it actually gives us a payment per month for every patient that we see because we have proved that we have the highest quality of care, PCMH level 3. But that is being discussed as something that will be removed, and it's really that foundational money that's paid for us to continue to be innovators. Neighborhood actually just received an award from the federal government for being one of the highest scoring quality outcomes for the patients we serve in the whole United States. And we are in the top 10 for health center outcomes for people in New York State. So we know that patients will be healthier if they come and see us. Those PCMH dollars are really necessary for us to be able to provide that team-based care that Keith talked about. The pharmacist is there on site, the community health worker, the medical team, not just the physician who is at the center, but he and she have a whole team of people. So that money is really important to us to continue to sustain growth and be innovators. We really want to continue to be innovators.
And that money is not necessarily money for a particular silo or particular provider. That's money for the center, right? Because of the mission of the center in bringing all of this together and ensuring accessibility and availability in the community.
And so it comes through Medicaid, goes to the insurance payers, and the payers pay us for every one of their patients that we take care of each month. So that's a really important initiative. And then the other is the statewide facilities transformation funds. Those are capital dollars. Some of it's earmarked for primary care, and it's really important for health centers. Again, as we try and reduce the number of patients that go to hospitals for care, community-based primary care, behavioral health offices really need those structural capital dollars to continue to grow. We said that we were lucky enough to get federal funding for our Blaisdell office, which replicates the story of our Lawn Avenue, right? We went to a community that really had no access to care and provided that through the federal dollars are to operate, but we used our own loan to do the renovations. We've run out of space. We're bursting at the seams at both the Northwest office on Lawn and the office on Niagara Street. And facilities transformation funds would really allow us to continue to grow and care for more patients. And it's vital for us. So.
And now you've got a mix of patient types at the facility.
Correct.
Some are Medicaid, right? Now, Keith is not Medicaid.
I'm not. I'm in the minority in that sense. I mean, our mission really is to provide health care to people who may not have access to it elsewhere. So I think that's critically important. I would just add to the PCMH dollars, the enhanced reimbursement allows our providers to spend more time with our patients than maybe a private practice physician would be able to. And that's critically important because our patients have a lot going on in their lives, and being able to take the time to really get to know them, understand what's driving their reason for being there, and having an impact on their health, not just providing health care, which is really, when you think about the mission, it's to improve health in the community, not just to provide health care. So those enhanced dollars really do make a difference because, again, putting on my board chair hat, having a financial orientation, that money allows us, makes the business model work to be able to spend that time with those patients. If that money were to go away, then we would have to be forced to change the way we deliver care. So it's very important.
Yeah, I know that that's one of the governor's proposals, and many times we rely on the good judgment of the legislature to reject proposals like that. And this is certainly going to be, I hope, one of them.
Right.
This has been wonderful to hear, not only from a board chair and the chief executive officer, president, but also from a patient.
Yeah.
This is wonderful. And I want to thank both of you for coming and spending this time with us. This has been Assembly Update. I'm New York State Assemblyman Robin Schimminger. It's been a pleasure having you with us. Thank you.